Good morning, ladies and gentlemen. My name is Ken Cahill. I am the CEO and co-founder of SilverCloud Health. Mental health is one of the greatest social and economic challenges that presents itself to us today worldwide. It's estimated that 1 in 4 of the population globally will suffer from a mental health issue or disease or condition in any given year. Traditionally, the problems with regard to addressing these issues with interventions have been around the areas of computer-based treatments, have problems with client engagement rates, very low engagement rates, very high levels of client dropout rates, which result in poor clinical outcomes. From a face-to-face therapy perspective, we have issues around an overstretched service, issues around stigma from a client's perspective of attending, amongst a number of other areas. SilverCloud Health has come through over a decade of academic and clinical research really designed into how can we use technology to enhance therapy and therapy delivery. From that, we've developed an online platform which delivers positive behaviour change and mental wellness programs, a very broad range of them covering a number of different areas and topics. I'm delighted to be here today to announce the partnership between Berkshire Healthcare NHS Foundation Trust and SilverCloud Health. It's the bringing together of two great organisations who are here to tackle the issue around interventions in the mental health space. It's bringing together Berkshire's experience and expertise from a clinical perspective, coupled with the knowledge of the IAPT service, as well as some really excellent content. That's coupled together with the SilverCloud platform, the academic and clinical research, a flexible platform that brings the supporter back into the loop in healthcare delivery. I'm joined today by Judy Chapman, who is the clinical director for Berkshire Healthcare. Judith, have you got a couple of comments you'd like to make with regard to the partnership?
Yes, we're really excited about the partnership because we feel it gives us an opportunity to spread the quality of our cognitive behavioural therapy treatment packages. And we believe that this will make it much more accessible. It will be something people can use flexibly when they want to, keep coming back to it. Our therapists can actually plan a very flexible approach to when they're available to support clients through their journey. And I think that's it. It will be their journey. Okay. We can make it personal for them and tailor it to help meet their needs.
And what are the key problems that you're planning, or we're together we'll plan on addressing?
One of the key problems for us is the demand for the service and also the demand to achieve the targets that are set. And also we are very measured on our performance, which is a really good thing to wisely make sure, for the government that we are spending the money wisely. But with that brings the pressure on waiting times. It brings the need to keep that performance high up there and to make sure that we are achieving recovery, which is to make sure people get well. So we believe using the SilverCloud platform, we will be able to spend our time to reach more people and to actually make sure they can get help immediately and not have to wait. So there's loads of advantages really how we
absolutely.
Can take
So you're destigmatizing, you're reaching more people and really sort of doing more for less, essentially. The key areas that the SilverCloud will be used to work on, mental health or other areas?
Oh yes, well we are a service, part of the IAPT program. Our service is called Talking Therapies in Berkshire, and we will be using the platform for our lower intensity interventions, which is delivered by psychological wellbeing practitioners. And this is an innovative way for them to actually reach more people. They do a lot of phone work at the moment, but it's booked appointments.
Okay, so Judith, how are you going to be using the SilverCloud Health platform?
Well, we're going to be using it in our Step 2 service, which is a low intensity run by our psychological wellbeing practitioners. And they're a very innovative, creative workforce who are always up for a challenge and will embrace this, I'm sure, really easily and really quickly, because they'll love the project because it really is going to empathise with the patient's problems and help meet them wherever they can use it, whether they can use it on their mobile phone, and also we can reach more people who are perhaps sedentary or at home as well. So within the Step 2 service, we will be using it to replace probably a lot of our phone support, which takes up a lot of time, and we're hoping that more patients will have access to this, and so that actually we can reach the 15% that's set by the government to try and reach 15% of need by 2015, and at the moment we've got some way to go to achieve that.
Okay, so the key is to reach and exceed that target, and we should be able to do that with the platform, certainly. In addition to that, mental health it kind of often is talked about with just anxiety and depression, but I think we were speaking earlier on and you mentioned that you see SilverCloud being used in a far wider area than that.
Yes. We are really hoping that we're able to develop using it in long-term conditions. The IAPT program, the Improving Access program, was set up for working age adults initially, but the challenge is to actually reach out to people with a physical health problem. And we in our service are a pathfinder site, IAPT, a pathfinder site for two projects, one for diabetes and one for medically unexplained symptoms. And we're really at the forefront of developing our Step 2 services to meet the needs for people who are struggling to adjust or have a difficulty with a long-term condition. And we are looking forward to developing modules to help treat people with anxiety, depression and a long-term condition.
And from your opinion, what have you found as kind of the biggest feature of SilverCloud Health that kind of made the decision to partner with SilverCloud?
I think for us it's wanting a quality product. And so knowing that there's been a lot of research and that we can see the high quality of the technical ability, that actually we just haven't got that in the NHS to achieve that. We've got the materials, we've got the experience, and we've got a really good team of clinicians. So matching that with your start of all the work in technology and building that together, I think is where we see the fact that, and also the fact that I believe the ethos of the SilverCloud company and the colleagues that I've met are people we want to work with.
Okay, great, thank you. In addition to that then, do you see any particular areas of engagement as being key? I know you mentioned before having that PWP or that clinician or the caregiver in the loop providing support. Is that key?
I think it's key. Obviously, we do have quite a few carers and family members who are really concerned about the well-being. And we do encourage people to share their results and share their treatment, but that's obviously down to them because we would never breach confidentiality. So the fact that they could share perhaps on their computer, they could bring in their boyfriend or their mother or something to help think about it and perhaps develop systems so that if they were particularly down, they could get some support. We like the fact that we can actually, whilst they're having their treatment online, that they can actually get access to numbers if they were in a crisis or if they were having a particular bad time, that they could go somewhere. The concept that they can actually access the product 24/7, because I think that's a key feature that we want to do, is to increase the extension of the opening hours for our service. We work 4 evenings in our service, which is quite unusual for a lot of services, but actually we just can't meet the capacity because a lot of people are working, particularly at this low level. There are people like you and me having a really tough time, they're struggling in their work, and the last thing they want to do is take time off work. So the fact that they can perhaps do it in their lunch break or could do it in the evening would be really useful.
Absolutely. And is stigma an issue as well? Stigma of attending face-to-face service is still an issue?
Well, stigma is an issue. We're trying really carefully to change the language that we use. So we talk about well-being, we talk about health solutions, and I think this is going to be really helpful that, we notice that, together we can work on making sure the language is fit to meet the needs of people out there to destigmatise it. But I think the fact that they can just do it quietly in their own home and their own time, they don't have to get time off, they don't have to say, I'm coming to my therapy session. And I think with the digital age that we've got now, they could be actually browsing, I better not say the company, but they could be browsing something to purchase something at home, but they can actually be browsing to make sure their health is improving instead.
Absolutely, thank you. Some great points. Thank you very much. As I say, we're absolutely delighted to announce the partnership between Berkshire Healthcare and SilverCloud Health here today. Thank you very much, Judy, for your time.
Thank you.